ADHD is our next key term. Attention Deficit Hyperactivity Disorder, ADHD, is a neurological disorder usually diagnosed in elementary school-aged children. It is characterized by inability to focus one's attention, excessive motor activity, and highly impulsive behavior. A child with ADHD is likely to have social difficulties with peers and with caregivers, develop low self-esteem, exhibit reduced academic performance and attainment, be more prone to accidents and injury, and may experience social rejection. As an adult, there is often poor occupational performance, attainment and attendance, and a high probability of unemployment and elevated interpersonal conflict. The causes for this disorder have yet to be identified. Although the genetic contribution can be found to be strong, the environmental influence on the development of the disorder appears to be as crucial. Research indicates that there are brain differences between children with the diagnosis and children who do not have the diagnosis, but specific areas affected remain elusive. What is known is that the ADHD brain matures slowly and has less gray matter in brain areas responsible for attention and emotion, with decreased activity in the dopaminergic and noradrenergic systems. The diagnosis of ADHD is clinical based on history and clinical picture. Several checklists, symptom lists, and behavioral questionnaires help parents, teachers, doctors, and counselors, and other caregiving adults identify symptoms and narrow down the diagnosis. At this time, there is no blood test or biological markers, neuroimaging techniques, or neuropsychological tests that can prove the presence of ADHD. However, it is possible to document high probability of ADHD, and the educational system can use the discrepancy between intellectual ability with lower than expected academic achievement, with suggestive irregular patterns of learning and knowledge. Diagnosis for ADHD begins with a broad-band assessment in order to differentiate it between other disorders. The Behavioral Assessment for Children and Child Behavior Checklist are two popular tests used for this purpose. If the WAIS-4 or the WISC-4 have been administered, look for subtest variability or a SCAD profile, which is the most useful in evaluating for ADHD or learning disorders. However, the WISC-4 SCAD profiles have not been extensively researched as yet, so SCAD information should be used cautiously for this purpose. The ADHD rating scale includes lists of symptoms that parallel those present in the DSM-5 for ADHD. Other instruments like the Stroop Color Word Association test can also be helpful in assessing behavioral inhibition. Let's practice with a question for ADHD. Which one of these is not characteristic of ADHD? Answer A, impulsivity. B, inattention. C, hyperactivity. Or D, oppositional behavior. D is a correct answer, as this type of behavior is not usually associated with ADHD. Answers A, B, and C are hallmarks of this disorder.